Welcome to this explainer. You know, hearing a doctor say you're at high risk for breast cancer, well, it's an incredibly daunting, overwhelming experience. It's completely normal if your mind starts racing the second you hear those words. But I want to start off today by giving you a deeply empowering fact right out of the gate. High risk does absolutely not mean it's inevitable. You can actively reduce that risk. Today, we're building an educational toolkit specifically for you, the patient, to decode the medical guidelines and show you exactly how you can take control of your future health.
So here's the million-dollar question on everyone's mind. If you find out you're in that high-risk category, can you actually stop the cancer from developing in the first place? The answer is a resounding, hopeful yes. And one of the most powerful tools in modern medicine to pull this off is something called endocrine therapy.
Here's our quick roadmap for today. We're going to cover 1. Reducing breast cancer risk, 2. Who qualifies for prevention, 3. 2 families of medication, 4. Finding your right match, and finally, 5. Weighing the trade-offs.
All right, let's jump right into Section 1, Reducing Breast Cancer Risk.
Okay, let's unpack this. What exactly is endocrine therapy? The textbook definition says these are medications used to reduce the risk of invasive and in situ breast cancers for women at high risk. But let's look at it a bit more conversationally. Think of certain types of breast cancer cells like tiny little engines that use estrogen, which is a hormone your body naturally makes, as fuel to grow. It's kind of crazy to think that a hormone your body needs to stay healthy can just be hijacked by these cells, right? Well, endocrine therapy essentially cuts the fuel line. By starving those potential cancer cells of estrogen, you drastically lower the chance of the cancer ever forming.
Moving right along to Section 2, Who qualifies for prevention? Let's figure out if this actually applies to you. Doctors look for specific criteria to see if you're a candidate. First, you need to be 35 or older with a life expectancy of at least 10 years. Plus, you gotta have one of these risk factors: a history of thoracic radiation before age 30, a diagnosis of lobular carcinoma in situ, a calculated 5-year breast cancer risk of 1.7% or higher, or a history of atypical hyperplasia. Look, I know that is a ton of medical jargon, but don't stress, you don't need a medical degree here. These are just specific checkboxes your doctor will look for in your chart. If your health history matches up, you're in the high-risk category where these meds are highly recommended.
That brings us to Section 3, 2 families of medication. Let's literally open up the medical toolkit.
When we're talking prevention, we're basically looking at 2 main camps of medication. On one side, we have SERMs. That stands for selective estrogen receptor modulators. The heavy hitters here are tamoxifen and raloxifene. On the other side, we have aromatase inhibitors, or AIs, which include anastrozole and exemestane. You might actually recognize some of these from a friend or family member's medicine cabinet. Now, what's super interesting is that while both groups work incredibly well, right now, only the SERMs are officially FDA approved specifically for primary breast cancer prevention. But honestly, AIs are still routinely recommended and used off-label by major medical guidelines all the time.
Let's transition to Section 4, Finding your right match. How in the world does your doctor choose between these? Behind the scenes, your doctor uses a clinical decision algorithm. Think of it like a highly personalized map. By looking at your menopausal status, your bone density, and your age, your doctor navigates this whole complex web to find the safest, most effective medication specifically for your body. It's a great example of how medical science treats you as a whole individual rather than just throwing a one-size-fits-all statistic at you.
The very first fork in the road on that map, the absolute most critical starting question, is simply, what is your menopausal status? Are you premenopausal or postmenopausal? If you are premenopausal, your path is super straightforward. Tamoxifen is the suggested option, and you usually take it every day for 5 years. The reason it's so direct is that aromatase inhibitors just won't work and actually shouldn't be used at all if your ovaries are still actively pumping out estrogen. So for premenopausal women, tamoxifen is your main shield.
But what if you're postmenopausal? Well, the map has a few more steps here to make sure everything is as safe as possible. Your doctor will run through 3 quick checks. Step 1, checking your bone density, usually with a recent scan. Step 2, considering your age, specifically looking at whether you're over or under 60. And Step 3, checking your surgical history. Basically, do you have a uterus or have you had a hysterectomy? Let's break down why these matter.
So about that bone density. Aromatase inhibitors work by practically wiping out estrogen levels in your blood, and unfortunately, that can cause your bones to thin out as a side effect. Because of that, if your baseline scan shows you already have osteopenia, which is early bone thinning, or full-blown osteoporosis, a SERM like tamoxifen is usually preferred, so we can protect your skeleton. On the flip side, if your bones are rock solid and normal, both an AI and a SERM are completely appropriate, and your doctor will move to the next steps.
Which brings us perfectly into our final section, weighing the trade-offs. Look, let's put the cards on the table. Every single medication has trade-offs. It is so absolutely crucial that we destigmatize talking about side effects so you can make a choice that you're comfortable with. Tamoxifen blocks estrogen in your breast, but actually mimics it in other parts of your body. That means it comes with potential risks like endometrial cancer, blood clots, and cataracts. Aromatase inhibitors don't have those specific risks, but like we said, they can cause bone loss and sometimes pretty severe joint pain. So how do we weigh this against your actual life?
This is exactly where your personal history tips the scales. The risks for SARMs, like the blood clots and uterine cancer, they actually go up as you get older. So if you're over 60 and still have your uterus, an AI might sound a lot more appealing to dodge those age-related risks. But hey, what if you've already had a hysterectomy? In that case, the uterine cancer risk from tamoxifen is literally zero. Poof, gone. If that's you, tamoxifen becomes an incredible option, especially if your main goal is just aggressively knocking down that breast cancer risk without stressing over your bone density.
Now I know listening to a list of side effects can be super intimidating, but we have to balance that against the massive benefits. We're talking about reducing your risk of invasive breast cancer by about 1/3 to 1/2. Cutting your risk in half, that is a life-altering number. Plus, tamoxifen actually helps reduce bone fractures. And get this, studies show that the protective benefit lasts for at least 10 years. That means 5 years after you take your last pill, your body is still being protected. Oh, and maybe the best news? Big trials found absolutely no significant difference in overall day-to-day quality of life between women taking these meds and those taking a placebo.
The medical literature really nails it with this quote. A choice among agents in postmenopausal women should be individualized based on their comparative risk profiles and patient preferences. Notice those last two words, patient preferences. The final call isn't just about a cold clinical algorithm. It heavily relies on what side effects you are willing to tolerate and what makes you feel safest. So I'm going to leave you with this to think about. Which trade-offs are you personally most comfortable with to protect your future health? You've got the knowledge now. You know how to decode the guidelines and what goes into making this call. Take this question and everything you've learned in this explainer right into your next doctor's appointment. You are ready to have a proactive, empowered conversation and find the match that's exactly right for you. Thanks for hanging out and learning with me today.